So scientific understanding of suppression. Everybody has their own concept. Even the whole generations of homeopathy had their own concept about the suppression, and we are carrying the same image in our own practice, materia medica repertory. We are explaining to the patients, explaining our understanding our own follow-ups also. The suppression has been there, the word, by intellectually everywhere. Case taking, understanding, follow-up, explaining patients, understanding the even conveying it to the patients and conveying it to our own self, and we are carrying for generations. So what is the exact suppression? What we understand, what we want to clarify first that, and then we go ahead with that. To talk about the topic, yes, I have the support of these two books. Mainly, again, I will tell you that it is here for your reference whenever you want to refer, because you will be talking about that very oftenly. First is organon, the most revolutionary part of the medicine in those time. What are the rules and regulation of homeopathic practice? Believe it or not, those who are even touching the homeopathy to some extent, they are following organon. It may be they are giving multiple medicine, single medicine, whatever it is. Because while taking history, the way we take history is also according to organon. Somebody may be doing very classically, following it completely, somebody partially. But when we talk to the patient, when we give medicine, we take follow-up, everywhere our organ touches to whatever the type of homeopathy we follow. This is the book which is more revolutionary, as Hahnemann said. If I would not have found out what is the theory of chronic disease, my whole practice or the understanding about homeopathy would have been failed. And first edition came into 1828, after about 20 years of the laying down the general rules about homeopathy, that it should be minimum medicine, single medicine, or minimum dose, minimum repetitions, triturated medicine, proved medicine. He was the first one to say it is medicine which has to be proved and then given to the patient. So first it is proved that this medicine is likely to produce this disease, and give it to similar complaint, that is similia similibus. And then the last edition came in 1838, that is in Paris. That was 1828 when he was in Cothen. And there are multiple translations done of this book, and which I follow is this done by Tafel. There are multiple. You will find that into that book, and backside there is materia medica also. Even the common medicine like silica is omitted by some author. Somebody has omitted ammon-cap, somebody has omitted rustrox, but this is the most reliable one, the translation. It was written in German and then translated by Tafel. Next. This is the book, the first line, the Hahnemann writes. Where? Organon. First line, before the book starts. He was wise, but he said that you have to do some daring. Hello? So even for talking something which is revolutionary, something against the flow, you have to be very wise, you have to be very daring. And today's topic is definitely daring, because the flow is going where? Everybody is talking about suppression. And today we'll be showing what Hahnemann used to think of it. What was the daring he had? It took 20 years to understand what is the suppression, why the diseases are coming and relapsing again and again. And from 1816, he started understanding that there is some problem. I'm able to treat the acute diseases. I'm able to treat the epidemic diseases, sporadic diseases. But I'm not able to treat the chronic disease, in spite of following all the criteria which he has founded till 1816. So what is that behind that I'm not able to cure? And from 1816 to 1828, he writes the note that before the call of the Almighty comes, I must declare it to the world why the diseases are relapsing. So that is what he is the writing, Ode Sapere. And at the end of his life, in his tomb, he is written that I have not lived in vain. Non inutilis, some word he is writing there. So next we start with that. So this is there is sensational, that is, I was in the group earlier, that theory of suppression से ये होता है, suppression से वो होता है, and this is something totally away and drifted away from that. Actual understanding of suppression comes, and that is why I say that you have to have a daring to talk about this topic. Nobody talks scientifically about it. But now we'll go to the why in the favor of suppression. That is what he has pointed out. And what we know of suppression. We know of suppression, that is basically it is physiologically or a discharge or disease. Discharges are suppressed, and they are suppressed and they produces disease. Is it very well there in the materia, very well there in the repertory also? And you take out the old materia, the genuine materia, even there it is written. So it is bound to that we are carrying that baggage with us, that suppression creates a lot of diseases. So what are they? Menses suppressed, milk suppressed, foot sweat suppressed, coryza, urination, gonorrhea, leukorrhea, ear and lochia. Suppression at the level of mind, also we have grief suppressed, anger and sexual desire suppressed, and they produce the following diseases. Next, the suppression in the skin, it is scabies, itch, and then applied by the ointments. Then in those days mercury or sulfur bath, and even the ulcers which has been treated. Ulcers in those days it was by surgically treated, even by ointments, each suppressed by the ointments, where the maximum suppression goes into the previous slide in the skin. Next, eruptions tendency to be suppressed and underdeveloped eruptions. Hemorrhoids, one of the major things, and surgical suppressions. Even the hemorrhoids are treated nowadays with the surgery, sclerosing the veins in the rectum, and they treated hemorrhoids. Even the fissure, they do the dilatation and then do the different more level of suppressions are happening to nowadays. It is not those days. It has been I have listed only those who are in repertory or in the materia medica. Next. Now, usual complaint which starts after the suppression, what you see is that asthma, convulsion, long list of the repertory rubrics. I have just made it concise. Convulsions, coma, rheumatism, paralysis, heart, dropsy, abdominal pains, and inflammation of different organs. There is brain, ovaries, retina, and different parts. Next. Even different materia medica, if they have given the references, there is suppression is happening. Now, such a vast topic, how it is to be explained, that how the suppression mean in those days and what is the meaning of exact suppression. Next. Next. Yeah, here I would like to have your understanding of suppressions one by one. If you can tell me what is meant by suppression, if you know, and what is the suppression meaning. As I gave you the examples of the rubrics of the treatment and the disease following into that. It is there in the literature. It is everywhere. Literature since after the Hahnemann time. Even if you see the Farrington book, even if you see the Boger's book, there will be listing of the rubrics and the materia medica also writing that way. Classical is like eruption suppressed and the convulsion starts. That is cuprum, zincum, something like that. Neurology, or the very well known as the skin eruption suppressed in the pediatric practice, and the asthma starts, or something like that is starting with that. Now, what is the meaning of suppression? That is what we have. Very crucial is that to understand. What is the idea or a meaning if you have? If you say one by one, it will be very easy to then to go to that. What is the suppression?
This is travels from less important organ to more important.
More important. Okay.
Something like
Okay.
driven inside.
Driven.
The skin side went into the lungs.
Okay.
Or brain neurology.
Yes, that is what the cuprum example comes up with. So disease from one which
Less
you have treated.
important.
Yes. So disease from one, it has gone into another organ because you have treated one.
Or
That
not
got
treated. It was not cured and it went to another organ.
okay. That is also another part of it. Okay. So manipulated and then went into the system. Yes.
Same, we are treating one disease. I mean, a simple disease we are treating, and if the patient comes up with a higher pathology,
Yes.
so that is.
So that's like a skin going into asthma, and very common to be seen in the pediatric practice. It is they come with the bronchitis. They already had from day one or day first week some skin complaint. Unknowingly they apply some ointment that is been prescribed by the dermatologist or the pediatrician, like you most one will they say, and they eventually comes up with the after a few months with the bronchitis. Yes, this is one classical example. Vaccination also, as you say. So vaccination they have not been.
Yeah, not treated, but because of vaccination and people come up with
Okay.
epilepsy,
Okay.
convulsion.
Okay, that is one. So after they induce some disease rather. Okay. Okay. Anything else? Want to give some examples of the suppression, or what do we understand of the suppression so far?
Suppression of diarrhea.
Okay. Yeah. So loose motions you suppress and something else.
Something else will appear.
Okay, that is one.
So it can happen at mental level also, where there's a prolonged period of suppressed emotion, suppressed anger, leading into some kind of another
Disease. So it's not the disease which is suppressed, it is the emotions which was suppressed. And then some disease has come up. Fantastic. And anything else? You have any idea of suppression, or what do you know of suppression? If everybody one by one, what do you know of suppression? I mean,
what
concept.
we believe was that the disease is being pushed from SORA to psychosis or syphilis.
So you mean to say the miasm, they have changed the miasm.
Change
From Sora you were treating, and now it has.
because of the wrong medicine or partially correct medicine, the disease has been driven inside.
So that is with homeopathic medicine, you want to say?
With homeopathy.
Okay, that
Or
is
it can be allopathic medicine.
okay. Any of the medicine, mode of the treatment can be any,
Hmm.
and the miasm is changed now.
Change.
So deeper, whatever you want to say. Anything else? Yes, one is the miasmatic phases changing. Yes, sir.
There are three layers
Yes.
in the fetus: endoderm, mesoderm, and ectoderm.
Yes, sir.
So the separation is on the level of ectoderm, mesoderm, and endoderm.
And yeah. So the different diseases may come up.
Skin is suppressed asthma. So same layer.
Yeah. So it may go into different layer and then it comes up. So that is of the fetal and development, and then at the level of that we have been explaining. That is meaning of suppression. That is what he says. And
Suppression of natural discharges like perspiration.
okay, that is always available like this. Today what we have the DOs, which is very closing their perspiring pores, and then some disease is coming up. Yes. Anything else about the suppression? Or do you have any idea of the suppression so far you are carrying since the formal education in college and thereafter into your training?
The example that they said, like local diseases were suppressed by ointments or local applications, and then they were driven into the system into some other form of disease.
And then it comes out with the some other. So one disease is
More severe.
so while treating one disease, it got suppressed, and the system throws out another disease, isn't it? Is that the real idea about it?
Sir, actually, it is actually the other way around also. At least we used to believe in earlier days that it is right. Wherein if you are treating a gross pathology, something like alopecia, and it is getting better, we're getting something at the skin ailment, another psoriatic kind of a disease. So we used to believe the medicine is right. So myself is shifting.
Okay.
So suppression ja raha hai.
Yeah. Okay, that way. So you are reversing the miasm, the suppression jar. That is how the follow-up you take.
Yes.
So even not the while case taking also you have that suppression in mind. Even while treatment you have that, and even in the follow-up also. So all three levels you have that understanding of the suppression. And something more of your experience, or what do you have the training formal in the college OPD, even after that, while interacting with the people. What do you feel of the suppression idea?
So what we were taught, which I never really understood, is that we were given an example that if a patient is having eczema,
Yeah.
severe eczema, and the dermatologist is prescribing a steroid
Yeah.
ointment,
Yeah.
and it goes away for a while, and then it comes back as
Okay.
psoriasis or
Okay.
something way beyond that. So that time we were told that that is because that eczema was suppressed.
Okay.
So we were taught that it is not necessary that it will come into a form of a different disease.
Different
It
disease.
can come again. It can
On the
come
skin
on
also.
skin itself.
But a little graveyard
Yes,
disease.
sir.
Okay, the graveyard disease. So she is of the opinion the same skin, but a skin in a different way, or if it is little serious or a deeper disease on the skin itself.
Yes.
Fine. Anything idea about the suppression, the theory which has been taught to us, that is in formal education and in the practice thereafter. So we have everybody started giving examples. That is there in the case taking, it is there in the follow up, it is there in the explanation, and even in teaching is, as he said, multiple levels that we have been taught about the suppression. So any example or the idea you have to express, or you have something to say?
Known case of a respiratory case in which the patient generally tends to develop bronchitis or asthma. In those cases, if sometimes the patient comes with more of only coryza or rhinitis,
Right.
And if we give only on the basis of the symptom like alien super sympathetic or something, then it generally seems this symptom settles up, but it depends on multiple person.
Asthma. So the one which was with the bronchitis, then it came with the common coryza, and again after treating with homeopathy, bronchitis came up again, or asthmatic bronchitis, whatever.
This is one case in which there is a event where the bronchial asthma generally used to happen
Earlier.
earlier. If only in coryza patient in no history of bronchitis or something, in that case
It doesn't happen. So known case, and they go into again they relapse. Relapse do happen. That is the asthma. So this is what the almost everybody is saying, right? So existing disease appears and the new one comes up. That is how the meaning of suppression. Next, original disease continuing and the new comes up. That somebody said. Original is continuing and something new has come up. Third, driving the disease back into the system. As he was saying, you have pushed the system. There was existing one disease, and while treating it, you have pushed that back into the system. वो system किधर है मालूम नहीं किसको. बोला बराबर है. System किधर गया वो? But we don't know. But yes, this is that true. Driving back into the system. Next. The dictionary meaning is this. Dictionary meaning of suppression is to stop something from being expressed. Very clear-cut understanding. As we know that there were skin in eruptions was there, or coryza was there, or diarrhea was there, or the long list which we have made, the perspiration or the urination and the stool and whatever it is stopped from being expressed. This is the literally and a flat meaning. Stop being expressed. That is suppression. Next. Disease suspended. One disease, another way of stopping it. The symptoms which are coming, they were suspended. They are no more expressing now. Next. Disease silence. This is the words used by Hahnemann very oftenly. When you see, you read his organon or read his theory of chronic disease, you will find it disease suspended or disease silence. Third, note. Metastatic. As you say that somebody was treating tonsils and again the kidney complaints come or the urinary complaint comes in, treating the rheumatism and the heart comes up or something like that. But they are known. Metastases are known because they are very well established. Those who are having chronic recurrent tonsillitis, this pediatric they may go into glomerulonephritis, isn't it? Or pyoderma, and then again going into that. Or say it is mumps, it was treated and mumps went into pancreatitis or orchitis. This is how the known metastasis it is there. Next, repression. Another word which is used by Hahnemann was repression. Again, different word of this is expressed or repression. Last. The scientific understanding of suppression that we will go to that. The scientific, what is Hahnemann mean to say? Here I say what requires order supere. Without understanding the Hahnemann, it is definitely order supere because what understanding we had, something different from that and what he mean to say, where he has said that. For that we need to understand next. Why we need to rectify. So why we need to understand this? What is the advantage of doing is this? Because then I found out when I go away from this, what is that advantage you get? There has to be something. कुछ मिलेगा तो जाएगा ना. खालती only study the theories and nothing coming out of it. You don't get interested. Why you should go in that? As I said to you in the very first time, that Hahnemann used to feel that from 1816 to 1828, when he published this theory of chronic disease, the first volume, he found that why I am not getting results in chronic. What is the reason for relapse? For 12 years, day and night, aphorism 80 is there. Everybody read aphorism 80 and footnote 280. He has explained very in detail. Before to me, there is only one doctor who has said about this, why the diseases are relapsing. In homeopathy, I am able to treat all acute, and that is why he got the epidemics and acute. Overnight fame into the Europe, whole over Europe. And wherever the European went as a colony, there the homeopathy spread it. North America, South America, Asia, Europe, and like Australia and New Zealand, everywhere in the world, it spread it. So when the answer he found in 1828, Surprisingly, those who were supporting him for all these diseases, answer to this, everybody deserted him. In 1828, when he published this book, Theory of Chronic Disease, then the age was around 70. So everybody a Satya guy. He lost his mind by publishing this book. But he said, no, I'm going to stick to my guns because I know what I'm talking. That is why he writes the word ode sapere. And that is the result, that if you want to result in a chronic diseases, recurrence, very stingy, stubborn diseases, you need to understand this, what is the suppression. How to get the result into the suppression. How to get out the mess into the suppression. Clinical, I will be giving you a few examples, how it helps to rectify the disease in a very fast way, gentle, quick, and longer lasting. That is what you see. So rectify your own knowledge of our science. That is very, very important. Homeopathy, because as I said last time, I don't know whether you have paid attention, that even allopathy doesn't suppress. Forget about homeopathy. That is what Hahnemann has written. I was surprised. He was staunch against allopathy, but he has said that by doing allopathy, it's not. It is easy to say, but it is false. Easy to say. Second, to solve the most chronic and resistant shock-up cases. This is the advantage for learning that to rectify our own knowledge, and then we arrive at that. This proper understanding will lead to solution of acute as well as chronic cases very fast, very clear that. Better knowledge will help to gain confidence and goodwill of the society and other medical fraternities. We are not against them. कभी भी गाली दे के फायदा नहीं, झगड़ा करके फायदा नहीं. Be in with them, be in the good books of everybody, because this scientific will change the things. Next. For that, we will understand the origin of disease. Only one man very clear since last 200 years how the disease attacks the man. Other theories are there. Infection comes inside virus, bacteria, and the parasites and everything, or even the chemicals, physical, chemical, biological, everything that makes you sick. He is of these phenomena. Origin of disease, and then how the disease attacks us. That is one, and how it propagates further all through the life. This is how he has explained in the book. And first, that is written, as I said, in aphorism 80, chronic diseases, page 33, how the disease attacks us. And chronic diseases, chapter is Sora. Very clear. If anybody wants to have it, they go through the book, and I have said this by Tafel. It's very interesting to know that when you go through this, you will understand. But the funny part of the language of those days, it is when we were discussing in group, even it is difficult to understand in first go. Very difficult. Second go, third go, you keep on understanding, writing it. It took me about 2 years to understand few of the words. For example, seat of the disease. You have to treat the disease at seat of the disease. What seat kidhar aaya? Where is the seat? So that, what is the seat of the disease? Where? Now this is one. He says that you have to treat the primary disease, primary part of the disease. Your man has come to you at the age of 70. Now primary disease kaise milega usse? How you get? Infant, you see, it is first year, you may be able to see that what is the primary, what is the first complaint came up. This is, I could not get the answer. A long number of months and now long number of years. And here lies the key to everything. We'll go through that. So first the origin of disease, how the disease originates, isn't it? And then you will understand what is suppression. And here's what he has said at different places. It takes place in a single moment. Most favorable for infection to occur. This infection occurs from the first in the contact through skin. Now somebody was saying that miasm is shifting, isn't it? So he said that in 1828 found out why I'm not able to clear the disease, why I'm not able to treat the disease, why they are relapsing. Then after 12 years, he came to know that all the disease enters into the body through skin. And there are only 3 miasms. And all 3 miasms enter through skin. So out of 3, he made it 2 very specifically. One is venereal. That is 2. Venereal mein psychosis and syphilis. And another one, non-venereal, Sora. So there are 2, venereal and non-venereal. Only 3. So total it becomes 3. And all enters through skin. One is venereal, can be only through that sex. STD, what we call it, sexually transmitted disease. Syphilis and psychosis both. And the SORA is not the syphilis or not the sexually transmitted. SORA transmitted even just by touching, even by touching. So these, all the miasm comes through, very clear now. Unless this is, तब तक आपका follow up नहीं सुधरेगा. Miasm can transfer or enter into the body through skin, doesn't by homeopathic medicine. एक में से दूसरा miasm, दूसरे में से तीसरा, ऐसा नहीं होता है. Very clear, venereal and non-venereal. Confusion होता है जब तक when your ideas and software is not clear. Software is corrupt, your idea is corrupt, and the result is also corrupt. So two miasms, basically venereal, non-venereal. Venereal में two, syphilis and psychosis. They don't change here. Entry is totally different. Entry is through skin, but a totally different. Sexually transmitted, non-sexual transmitted. That is plain. Next. So one, it is infected through the skin, and after the infection through skin, the period of time during which the whole organism is penetrated by the infection until it has developed within completely. Internal development is over. Now, what is the example? What he usually gives it to us, that, for example, measles, for example. So once infection occurs into the body, or smallpox, any viral or any infection comes into the body, it develops all through the system, and it has its own prodromal period, and then it erupts. So 3 levels. Same way he has developed how the chronology has made it. So that is internal development is over. This development is the very crucial development. So unless it is there, it is not coming out. Unless it is fully developed, it doesn't come out. So first is infection, second is internal development, third one, infusion. As soon as the infection touches the skin, it remains no more local. This is very crucial again. It remains no more local. Even modern medicine says the same thing. So once anything enters into the body, below the dermis, what happens? The whole of the immune system comes into the play. It is not the only lymphocyte, it is not the only platelet, it is the whole humoral and cellular system comes into the play. It is not the no more local now. It is no more local. Second, the nerves affected by it then communicates in an invisible dynamic manner. He didn't know that how it. He didn't know that time. There was no science developed. But somehow he knew that once it enters into the body, the nearest sentient nerve, nearest nerve carries it to the whole of the body. The whole body is infected. Whole body. And it is true because it's more than the electrical speed. Cellular humoral may take a little longer, but by anything going through now is very fast. This is how the disease penetrates the whole body and in all directions. Is that clear? How the disease spreads into the system, that is what he has explained, and then the whole body is covered up internally. Next, the miasmatic disease. Now the disease which has infused, now it has spread all over, its complete internal development in the whole organism. The modern terminology, incubation period. And during this incubation, after, here is the seat of disease. Here is the seat. Seat is here. Once it is developed all through the body, and the whole body is the seat now. Whole internal mechanism is the seat of the disease. Seat of the miasm. That is, now here is said, complete internal. Miasmatic disease, complete internal development. Here is the seat of the disease. I'll tell you the aphorism where it is useful to understand this. Next. And third is the outbreak. Now internally it is all developed. The miasm is nothing but the chronic inflammation, acute and a chronic inflammation. First it is inflammation. Defense system, inflammation, everything is miasm. Defense system is weakened and the inflammation comes in, inflammation develops and it erupts out. After complete internal development, the disease vital force, that is defense system, that is how I try to interpret. It is not, may not be the exact term, but it is how commonly we try to understand, that tries to soothe the internal malady. That is, once the virus or the bacteria is inside, defense system tries to contain it, control it. In containing it, control it, it is the inflammation by establishing a local symptom on the skin. Now the first is flare-up, something come out. It may be virus, so it may be typical rash of that virus. It may not be virus, it is just the cradle crab. There is no infection, only the cradle crab. The first week, what do you get? Cradle crab. सब बच्चे में कॉमन होता है ना. It is very common. You see, there is no symptom, there is no itch. but there is a cradle crab. That is what one of this is, and the external manifestation of the internal sora. That is the external manifestation of internal sora. These irrational signs acts as a substitute to जो पहले जो अंदर गया था, it is all substitute to that, because internal से external express हुआ, but internal खत्म नहीं हुआ. Your internal is continuing. The inflammation into the system is continuing. Next. Signs and symptoms of the first time breakout in the infancy is known as primary. First sign, whenever the first time disease has come out, is a primary. This to understand what is the primary in the age of 70 or age of 35, 40, whenever it comes, even 5-year-old, very difficult to understand. Once you understand this, your history taking and everything will be so fast. In a couple of minutes, you can finish the case. And even medicine comes very fast. So primary, Hahnemann says very often and often, from aphorism 5 it starts, to treat the chronic diseases, what you have to treat is internal miasms. ये अभी तक समझा नहीं था. What is he trying to say? उसको बहुत साफ, when you read it with synchronization, here, there, he has, all the literatures are scattered here and there, not in chronology, what we are trained in nowadays. एक chapter में 1, 2, 3, 4, 5, second chapter followed by that 1, 2, 3, not that way. So this primary symptom is the real symptom. This is the symptom because the miasm which was affected first, उसका expression ये है. Next. They keep the miasm confined. Now when the external signs body के ऊपर आ गया, the internally restlessness of the body and the defense system is quiet. Once the disease is thrown out. So different word is used in the literature by him. This miasm is confined, covered, lettered, slumbering, and bound and quiet. Is it clear now? What is the slumbering sora means? What is this quiet sora? This is no more inactive. Cradle crab has come up. It is not inactive. It is lying quietly. और चलते रहता है. The patient doesn't have much of complaint. छोटा छोटा है, कभी कभी सर्दी होता है, ये होता है. Everything here and there, but it is going on. If these external signs, now this is most the crucial one. If these external signs are allowed to advance with mere local external application or not treated, as he said again, even otherwise not being treated homeopathically, if not treated homeopathically, if locally managed or manipulated and not treated by homeopathically, the whole miasm will increase rapidly and develop into various diseases sooner or later in the life. We do hear that 35, 40 years hell and hearty, doing too many things, discipline, suddenly got heart attack. Suddenly उसको stroke आ गया. Suddenly ये हो गया. Suddenly कुछ नहीं होता. It has some background. Something is going on and on and on. पता नहीं चला वो अलग बात है. He was so hell and hearty, 40 years तक बुखार नहीं आया. 45th year is died. ऐसा कैसे होता? So he says the sooner or later, and he says in his own way that it's robust constitution. Those who are doing even the robust life, healthy life, they also succumb to somewhere in the disease later on. Next. After the breakout, the infusion of the disease, I don't know, rather I could not make the animation of the whole thing. बाहर से अंदर गया, spread हो गया, and then the breakout. And this is after the infusion, disease spreads into the whole body and fully developed single infusion makes the foundation of all the future miasmatic disease. And this is the seat of disease. This is the seat of the infusion के बाद जो develop हुआ whole of the body में, that is the seat of the disease. And that, to understand this word, is in aphorism 200. If you want to understand that what he says, seat of the disease, aphorism 200 is the aphorism for taking follow-up, homeopathic follow-up. How to take the follow-up in homeopathy, how to understand once you give the remedy, whether your remedy is acted or not on the very first day or very first few moments or very first week in very chronic case, whether your medicine is acted or not. If you understand, then the aphorism 200 has been given. Very clear-cut understanding. He follows the same line, but here and there. As I said, it is you have to follow his understanding. Next.
Sir, so this is the primary symptom that we are talking about.
Yes,
Right?
this is the seat of the disease, and from where first expression of the disease is a primary. So
But then how do we get it in clinical cases?
that's what I'm saying. That will come to that also. But the primary is the disease. Then he says in his literature that primary, if I know, then he case that I would have given the dose of sulfur and saved that child from the all future ailment. Because the inflammation which has been first inside has been treated homeopathically. Go back again. Here. If not treated homeopathically, if managed by any local application, then it will go on increase later and later. So he gives the example in Theory of Chronic Disease in the chapter Sora, that if I would have treated that child for that itching part or the day and night baby's itching, given a dose of sulfur, the flower of sulfur, what is that baby would have been saved from the whole life of diseases, from all miserable disease he can save. That is what the internal medicine is, not externally. Internal homeopathic medicine, well-proved medicine, is to be given. Then he writes further, according to as you say, I'm trying to explain, that if the child comes little later, second year, third year, same sulfur will not act. Same sulfur doesn't act. So in that case, you have to search for another remedy rather, and then later on you may come to sulfur again. It may not be. Once you start, years goes and goes, it may not be in the same form. The Sora, the primary expression changes. So then you have to consider secondary, tertiary, and and so on. Is that clear?
So based on the symptoms, we have to change.
Yeah. Whenever the patient comes, whatever the patient is presented, you have to give that first remedy. When that is clear, the anti-miasmatic remedy has to come into the play. Next. So it is not the only sulfur. Later on, in those days, it was yes. I have treated the psoriasis. A child coming into the second month of their life, if she has taken the case. First month, severe fulminant psoriasis. First month, day in and out. You can imagine the misery of the parents. Pediatrician, अरे the skin वाला बोला इसको हम वो दवा नहीं दे सकता जो बड़ों को देता है, like methotrexate. And they were the North Indian, so they knew homeopathy. Came to us. It took about 6 to 7 months to find out the actual base. Miasm में जब तक गया नहीं. This is the idea of understanding of this. Unless you reach to miasmatic remedy, psoriasis नहीं जाएगा उसका. The infant, second month in the life. I have 3 kids thereafter. And think we have showed them also in the video that this is how it is. And even in homeopath के पास बहुत difficult, unless जब तक miasm का और disease, how it enters into the body, how the disease develops, उसका पूरा understanding नहीं होगा, homeopath cannot cure it. After the breakout, to soothe the vital internal, it may be appearing that I am trying to repeat, but this is imposed that what is the actual theory happening and how it is coming up. Internal vital economy, that is what we say is defense mechanism. The internal disease is expressed on the least dangerous part of the body, that is the skin. That is very common. The signs and symptoms are observed near the site of first infection. Here again very crucial. It is not the only Sora. Even if it is syphilis, even if it is gonorrhea, it is expressed at the sign of first infection, isn't it? So in sexually transmitted disease, you will get the discharges in the gonorrhea or the warts into the psychosis, and if it is syphilis, again chancre or the bubo. And wherever in the Sora, like the people are very touching to the infant scalp very easily, or the face and the genitals, and that is the area they get the infection. The first time it will happen. Wherever it has entered in, it will happen. Wherever the miasm has touched the nearest nerves, this is where it is expressed. This is how to get the primary in the early stage. But when as I said, the severe psoriasis, very difficult. Kidhar first laga tha, that's already changed. Second, this process of nature, that is breakout, repeats itself. Now he writes very beautiful things. This is what he says. In the chapter Sora, that is, first he writes the introduction, that how I came to understanding of the disease, how it enters, spreads into the body, and breakout. About the theory of miasm, he writes how we came to the conclusion that miasm. Then he writes 3. First syphilis, then psychosis, and he starts about Sora. After the breakout, in the second paragraph, he says, this process of nature, that is infusion, infection, that is then spread, the prodrome, and then the bar. The breakout repeats itself continually. And evermore, in the same manner, in the chronic miasmatic disease and the acute diseases. Same way. कहाँ से आता है? फर्स्ट चीज जहाँ से गई थी फर्स्ट हिट वहीं से वापस आता है. So as I said last time also in my talk, it is like in our culture ये बोलते हैं ना छठवे के दिन, 6th day of the life, Vedanta writes everything. It is all written there at that time. That is what you want to say. Continually from there it is repeating itself. Now you will understand this suppression का जो idea है ना कहाँ से आता है. Next. On page 17, that is in the first what he writes, and that he says then Hahnemann has noted down that he in those days he always writes, if you see even in the organon, large number of examples, maybe by 20-30 pages he has given my observation, this scientist ka observation, that scientist ka observation, before to me it was Galen, before to me it was Hippocrates, it was like that. He gives large number of examples from page 18 to 30. This miasmatic disease ka, and this fury of internal miasmatic sora manifesting itself when external local symptoms which were soothing to the internal malady are hastily removed. Soothing to, like you are applied something, for example, applied something and that has gone off, or as you said decongestion लगा दिया और कुछ दूसरा आ गया. So something which has this fury of internal fury. Next. Disease which are acute as well as chronic arise from the destruction mainly of the skin symptom like eruption and itching. Eruption and itching. In those days there was no anti-allergic medicines. There was only local application or baths or something like that. We have the anti-allergic medicines, we have steroids, we have even the immunosuppressants or biologic to control the itching. There are multiple. So we have to change this kind of understanding that itching may not be only local application. It can be anywhere else. You are managing that. Original symptoms like itch and eruptions, when destroyed, they produce innumerable unrelated vicarious disease. Unrelated means skin से गया और skin आ गया ऐसा नहीं. Or once it was there eczema, as you see, every patient has the experience. They have applied something at the same place, the eczema comes up. It may happen for some time, maybe 1 or 2, 3 years, and then something else comes up, which is not related to skin, as everybody knows. It like even the vicarious कहाँ पे आता है आपने natural discharges, vicarious menses, bleeding through nose while menses is going on, something unrelated, and that is how the vicarious disease comes up. Vicarious का exact meaning is unrelated things are coming up, developed. Next. These innumerable diseases are manifold and modified as per the peculiarities of the body and the constitution to the outer world. How the disease develops thereafter. First year gaya, second year gaya, third year gaya. How the disease develops thereafter. Very clear-cut idea is given. Diseases are modified by where you are living, the way you are living, your bodily and outer world. The where we are living, marshy place, dry place, hilly place, snowy place, monsoon, whatever the place you are living, the external factors, they make lot of impression what kind of disease. So if you see the Harrison textbook, every disease they write the where it is spread all through the world. So certain diseases are here, certain diseases are here. There is less frequent here, less frequent there. This is what it is. What's in external factors. The world where they are staying, they mold what kind of disease you may be taking. Malaria is are more here, something is more there, like that. So got the idea now? How the disease enters, how they develop second, third year, fourth year, like that. Next. On page 17. What do you write? He counteracts all the understanding of the suppression by any ridicule. On page 17 he writes, because different edition and different may have a different page. Okay. Removal of the skin, everybody is saying about removal of the itch or the eruptions or the decongestant or anti-allergic or whatever you say. Such symptoms of the internal sora, that is internal is the seat of the disease message is erroneously called driving into the body. Somebody said no, this okay. I was in the same class कि अंदर दबा दिया, है ना, एक बीमारी गया और दूसरा आ गया. He said it is erroneous. It is erroneous to call the driving the itch, or it is erroneous to call it as a suppression. अभी तक because we were not, it is not in our syllabus. Formal education का syllabus में नहीं है. So nobody reads. And there at the same time he writes the same thing. And here thereafter he gives from this whole, whatever he is trying to say, the whole example is given from page 18 to page 30. That is how the miasm is behaving, how the diseases are developed, and how they remain into latent sora. And then latent sora ka example, the quiet sora ka, these silent diseases which are going on, it is given from page 45 to 76 of the same book. Imagine this, now 12 plus this 30. 42 pages he keeps on giving you examples. What I am saying is this, मैंने ये eclair नहीं बोला, इसने somewhere in the London somebody said, in the Britain, somebody in the France somebody saying, somebody in Italy, Portuguese, Russia, that he gives the example here, different scientists. But that usually what happens when we are reading the main pages, it takes so much time, we just keep those examples. And we go to like a lazy student. बहुत हो गया, syllabus खत्म. So we go to the jump, and that because of that jump, we don't know the examples. So he has given the examples of this convulsions, coma. Where we put convulsions and coma, usually आजकल के मायाजम के हिसाब से syphilis. He gives in soda. Nobody has countered. Even I was not countering the question. इसमें तो ये दिया है. तो the explanation one came कि उनका बहुत सारा idea erroneous था, obsolete था. It is not. It is still true. In today's world, it is still true very much that this is erroneous to call, and driving inside that itch into the body is erroneous. And why erroneous? That we will come to know now. So inference. Why this concept and myth has solidified firmly through the generations of homeopaths. But still, it is there. The concept is still there. Suppression आता है, suppression होता है. What we know about the suppression is because master has given many examples of allopathic mode of treatment, and it's equally in number of references, examples कि ये बंद किया और ये चालू हो गया. But what he says is true. So-called suppression of disease is a myth and does not have support of any medical science. No medical science is thus given. Allopathy वाले तो बोलेंगे नहीं, because they have seen patient is very well common. Exactly meaning is the just suppression of expression of disease. I have a diarrhea, I have given a medicine to produce constipation, or they may give antibiotic of diarrhea. I have a constipation, they give the medicine of cleaning the bowel. You have the cough, you give suppressing the cough. That is the suppression. That's the only one thing. Suppressing the expression. Suppress करके दूसरा disease आया, वो नहीं होता है. दूसरा disease आएगा same because of the miasm is already there, and that miasm produces another disease. That miasm produces third disease, fourth disease. And that is not the because one is suppressed because अंदर गया और दूसरा एक खिड़की बंद हुआ दूसरा चालू किया. Not like that. दूसरा यानी कि another disease come only because of this suppression. It is already a ground is made, and that made ground is producing all the different diseases at different level. Next. Now, why the diseases are assuming different form of disease? Now, if not suppression, what produces the disease? Suppose, if I said, ना suppression नहीं होता है, चल, ये बोल के नहीं चलता ना. He has explained that if not suppression, what produces the disease? Why the diseases are produced one after another? As I said, one is the area where you are staying in. Second is the constitution. So this understanding has improved the history taking at a large. History taking is completely different after understanding Hahnemann. Completely different understanding. Disease कहाँ से आता है वो पढ़ो, वही history लो ना, दूसरा जरूरत नहीं है. Fine. So one is bodily constitution. So what are the aphorism 5 says that ascertainable physical constitution. So one is very tall, one is very obese, one is very short. Whatever the physical you get, or the cachexia somebody is developing, you take that way. or the grief and the obesity. It is also one of the very important rubric. Defects in education. Habits, that is what the vices, you can put up everything there. Employment, where you are working, the way the employment environment is working. External circumstances like lifestyle, psychical and physical impressions. These are the causative factors. Nowadays, you take history of any patient, you will be asking questions related to this. Next. Gloomy and close room, wrong diet, inferior food brings down men's strength and courage. That is what he says. And then environmental factor, he lists long list of 73. That indentation, कभी भी flood जिधर बहुत आता है, drought जिधर बहुत आता है. That is what everything he writes in this environmental factors. These are the factors which are triggering factors, physical and psychical. That is second is now, as you were saying, that suppressed grief. The grief is one of that. What are the grief which produces the diseases? Which kind of the grief you have seen in your practice, if at all?
Disappointment in love.
Yes, very common.
Financial loss.
Financial loss.
Death of loved ones.
That is the grief which is not been understood by homeopaths. Death of loved ones. Not been understood, not been paid attention much. And that's the real grief. But he has said it is in his time also the unhappy occurrences like miscarriages, sad tidings, that is news and informations. That is what the cause of the diseases in the psychic level he has. I have been saying only everything is from here. Might be little word here and there, nothing out of this chronic disease and organ. Okay, because I find it is more relevant in today's date than any other thing. Last is unhappy marriages, that is one. Unjust or a criminal suit. Next. Constant. This has to be constant. Simple one or two incident may not be leading to, but a constant vexation, a state of being annoyed, worried, frustrated, something that causes annoyance or trouble. Continual. What does he mean to say? He is using the word continual vexation, long. Stress and worries, fright, severe and violent, loss of failure in business, loss or a failure in business. Next. He says here, previous, go to the previous. Yeah. And he says now, lastly into this whole of the occurrences, that if patient is not willing to give up stress, then he cannot be treated. Lastly, he says, next, again, physical, shock, breaking of arm or a leg, fall, wound, considerable burn, hard labor, confinement due to disease, sedentary occupation. Next. Local treatments, severe cold, fever and acute diseases, aggressive or improper treatment. That is what it is, what we see every day in and out. This is one of the cause. Local treatment or for infective skin. That is all. Next. When you remain healthy for years and years, you may be infected with the sora, it is remaining quiet, latent, dormant, it is covered up or inactive, and there is the reason for that. He says for both things, when you fall sick, why you fall sick. And in spite of getting the sora, you may remain quiet for long number of years or years and years together. Healthy, you may remain healthy in latent sora. Proper income, good income. He was poor all through his life till he moved to Cothen to Paris. In Cothen also he had some money, he could build his own home, but then till that he was about 60-year-old. Does not live in vexation or grief. Continuous grief can produce a problem. Does not overexert himself. You know, nowadays there are many news coming up. 42 year का ट्रेडमिल पे मर गया. सुबह शाम एक ही काम. Exercise. Too much is very problem. Too much. But even this too much of exerting to himself. Even that gynecologist died on the road, marathon pe. Too much. Yes. Quiet, cheerful, equable patient. Contented disposition. they don't suffer much for many years. With such person, Sora may slumber for many years without causing any continuing chronic diseases. You may remain healthy even with that. Even he has said to one place that you are, the earlier there was a treatment when there was not much of the good antibiotics or the anti-tuberculosis. They were good to go to sanatorium, hill stations. That is also one of the which I have not included here. Going on a vacation, distressing. So we are doing actual distressing nowadays for a few days, 2-3 days. But in tuberculosis, they were transferred to the. In fact, that sanatorium, the what you can say, the culture is closed now, stopped now. So earlier it was a sanatorium. Yeah. Next. Good. So references is taken in chronic disease ka first is 15, the footnote. Chronic disease, page number 16 and 17. These are very crucial to understand why the disease, and if it is not suppression, it comes into an aphorism 200. What is aphorism 200? It may be too long. If we have time now, I think I would be interacting more. 200, as I said, it is for, just a minute. 200 was follow up, and 202 is something which we will display now. 202. 202. Further. Yeah. Now, as I said, the allopathy also do not suppress it. That is what Hahnemann said. Here he says. Aphorism 202. If the old school, that is the allopathy, physicians should now destroy the local symptom. That is what we say now, by applying or doing something, whatever manipulation. The topical application of the external remedies under the belief that thereby cures the whole disease. वो होता ही नहीं है. That is definite. But if he is doing it, let's say, is it doing it? Nature makes up loss by rousing the internal malady. What is happening when you do it? Internal malady. जो पहली बार में गया था ना, उसको ही rouse मिलता है. Okay. And the other symptoms already existed there inside. Side by side with the local affection क्या था? Skin का already था, या whatever the asthma or diarrhea, whatever the infant may be having it. Or even the grown up में और कुछ नहीं है. I have seen so many patients, they don't have any even post inflammatory or any silent infection or inflammation on the skin. Very neat and clean. 87-year-old lady, not having single teeth missed out, not pire or anything. Very healthy. No skin complaints. So don't have this aura must be remaining for a long time. That is to say, the local affection, that is to say, she increases the internal disease. Got this? How we says in aphorism 202. लोकल ट्रीटमेंट से ये सब किया, उसका मतलब ये तो होने वाला ही नहीं है, बट नेचर मेक्स एक विंडो बंद किया. तो व्हाट द नेचर डज, द इंटरनल ऑलरेडी था, देयर वाज अ सोरा इनसाइड, इट मेक्स द लॉस, एक लॉस हुआ तो सेकंड टू स्टार्ट विद. दैट इज टू से शी इंक्रीजेस द इंटरनल डिसीज. ओके. नेक्स्ट. व्हेन दिस इज समथिंग व्हिच ही राइट्स, व्हेन दिस अकर्स, एक बंद हुआ दूसरा चालू हुआ, दैट इज सप्रेशन, isn't it? Everybody said. When this occurs, it is usual to say it is suppression, though incorrect. It is incorrect to say that this is suppression, that the local affection has driven back into the system upon the nerves. As we said, no, the disease is carried into the system by nerves. It is incorrect to say that. It is already existing. तो एक वो दबाया इसलिए दूसरा ऐसा नहीं है. What you are doing by this is you are compromising the immunity of a person, and that compromised immunity produces the second disease, third disease, fourth disease, whatever it is. It is not because by manipulating, ये तो दूर होने वाला ही नहीं है, but by not removing, by closing this window, nature itself, which is already existing there inside. So how the disease travels is just very clearly first one. Infusion carried into the body by nerves, and then the disease, then the whole of the prodrome and the eruption. It is not been the first one. एक ही बार होता है infection, and seat of the disease may say different disease keeps on coming. So it may be any disease which is coming up.
Sir,
Yes.
what about congenital disease?
he has, that is all psoric diseases going through generation. If you see in the organon, he has given the explanation that how the earlier it was leprosy and now it is psora which has come up. It is going through generation in generation.
Congenital hydrophilic people.
Yes, it is all psora. Everything is psora, unless you can see the sexually transmitted, that is gonorrhea getting transferred into second and third, and that is the psychosis or that is the syphilis which is going on, which is very rare nowadays because now the treatments are available. We don't see the flared up.
Undescended testes.
It's all psora, sir. Everything is psora. Everything is psora. This is how aphorism 202 and there was the page 17. It says that there is not the suppression. It is erroneous. One place he says erroneous, and it is here he says incorrect. It is incorrect to say that एक disease गया और दूसरा. It is already existing है. So that is why I said it is fine. That is what the allopathy वो बोलते हैं ना patient. Allopathy सब suppress. Yes, definitely suppress. They suppress the expression. So painkiller, pain है तो painkiller. Infection है तो anti-infection. So everything is that is why they have perception. But एक ये कर रहे इसीलिए सब बीमारी आता ऐसा नहीं है. Otherwise, every patient goes to allopathy will come up with some different disease. It's not happening that way. Think they logically also. एक ही disease. So, suppose for example, a lady had too much of menorrhagia, goes for hysterectomy. Doesn't mean that she comes up with another third disease. It is existing there. Or existing disease कौन सा आएगा? Where they stay and how they are. That is what he has given the criteria. That what are the disease development का क्या क्या criteria. So exactly it is not. So once we, and as I said, when you correct the understanding as per his teaching, and what is the now solution is? Now where is you have to treat the seat of the disease, that is psora.